Hi, this is Dr. Roy Kim. So what should you expect when you see me for your breast augmentation consult? Of course, we're going to talk about the details about your procedure, exactly what you want. I will listen to you. You will try incisors. But as a quick introduction, let me lay out exactly every step. Before you even see me, you should actually prepare yourself. I assume that you've done some educational research on your own, figuring out some of the basics about breast augmentation surgery, breast implants, type of incision, recovery times, all those good things. So I will definitely help you go over those when I first meet you. Also, when you come, you should definitely try to come with a tight top that has no padding. Perhaps even bring a bra with no padding, although we will provide you one when you try on incisors. And you actually also want to have maybe even 2 or 3 different tops to bring in at the day of your consultation. So why is it important to actually bring in something that is not padded, not thick like a sweater? The reason why is that we're going to ask you to try on incisors. So we have a non-padded bra, we have various incisors, and you can actually try on, see the implants and try them on yourself and look in a large mirror to see exactly what size you would like or not like. Next up is understanding the procedure. So this is where I go through the plastic surgery nerd talk, and after listening to you and you're going to show me exactly what you want, whether it's photographs or just talking about it, I'll break it down into various technical aspects about breast augmentation. So typically I like to go over the type of implant, whether it's saline or silicone, smooth versus texture shell, where it's placed above the muscle, below the muscle, technically above the muscle but under the fascia, the incision that is actually used to place the implants, the profile, in other words, how wide, how thick the implant is. You will help me choose the volume, and volume is one of the criteria, but as you know, especially after watching all my YouTube videos, it's not just the volume, it has to fit your rib cage, your torso, your breast measurements to give you the best look overall. They've added a new twist in the past couple of years. There are now different levels of cohesive gel and how they feel. So in other words, when you squeeze implants in the office, some are softer, some are more firm. Typically, most of my patients want the softer implants, but you could be the judge yourself. You can actually feel them, and we can also figure out what's best for your body. Of course, breast augmentation is a procedure, so every procedure has risks and benefits. Some are unique to just having a breast augmentation. Some of the risks are sort of vague or general. In other words, you're having surgery, you're having a procedure. There are some general risks that I think that every surgical patient has. And finally, there are definitely going to be some specific risks for you. Yes, you're having breast augmentation, but every person is different. And you may have different characteristics in terms of a higher risk or lower risk compared to other patients. And we'll go over all that in the office. Of course, you'll probably want to know exactly how much pain you're feeling, which is actually very little, and also when you can get back to life and get back to work. Typically, I inject long-term numbing medicine at the end of your procedure, which lasts for about 72 hours. So virtually all of my patients have very little to no pain. You don't have to be a hero or heroine. You can actually take pain medicine, but a lot of my patients actually don't need very much pain medicine after the first day. There's also not that much swelling. So specifically, because of advanced surgical dissection techniques, along with very good compression garments, most patients don't have that much swelling. Because you're not in that much pain, and because also the pocket is dissected carefully, you may feel little to no soreness as well. And you should be able to move your arms above your shoulder or even higher, like the first night after surgery. You can definitely relax at home, and I recommend that you prepare your house and your place, specifically bedroom, to have a clear path to the bathroom and other hints so that you can actually recover more efficiently, and will help you prep that stuff before you actually have any operation. In terms of cost and financing, even before you step in, we can give you an estimate. However, every patient's different, and sometimes there are things that I see that I want to fix. For example, some patients may feel they don't really need a breast lift. Sometimes I feel strongly you do, sometimes I don't feel strongly at all, and we can go forward with a breast augmentation. And there are subtle variations in terms of the exact breast implant that you choose in terms of pricing. Typically though, the average cost of breast augmentation is a little more straightforward because there are fewer variances with patients. And of course, financing is a big deal. So in other words, of course you can pay for everything up front, but if you need help with cosmetic surgery financing, we can definitely recommend you to great companies with great reputations that can assist you on that. Another thing that I recommend to patients is actually write down a list of questions you may have, along with some inspiration photos to bring in. That really helps me because most of the questions, which are pretty common questions I'll answer in this video or actually during the consultation. But if you have specific questions that are really related to your situation, it's always great to write it down so you don't forget. Inspiration photos also help me a lot because what you want and what you desire helps guide me into figuring out the best procedure for you, whether it's possible or not, or specifically what type of implant model, implant width, thickness, profile, etc. would deliver that result for you. So there are some sort of differences between slightly different breast implants, and we can go over that during your consultation. So I hope this short video helps guide you through the process of an actual consultation in reality with me. If you have any other comments or questions, you have any other questions or other suggestions for videos, please fire away at the comments below. Thanks so much for watching.